Thank you very much. So I'm going to now tell you about NPIs. I figured telling you about vaccines was a bit boring. Now I'm going to tell you about the exciting things. Okay, it's not that exciting, but a little bit more exciting than vaccines. So do they work, all of these NPIs? So just quickly, I have no financial conflicts of interest, and non-financial I've listed. So what are NPIs? Well, literally, they are any measure we take during an infectious disease outbreak to reduce the transmission of the organism, whether it's a bacterium or a virus or a fungus, and that this measure is not a biological measure. It's not a vaccine and it's not a therapeutic. And usually with NPIs, the uptake and the use of these NPIs is encouraged through various approaches. We advise people, we give them guidance, we regulate it, and so on. So these are really behavioral, social, physical, environmental, and regulatory measures that we use alongside vaccines and drugs when they are available or before they become available. So it's literally the first line of defense to contain an outbreak and to limit its impact in the population before biological interventions become available. So it's your first line of defense. So what do we know about NPIs? Well, there's a terrific report. This report was put out by the Royal Society in the UK, and this report is the most comprehensive analysis of NPI. You can get it, it's freely available on the internet. Just put there Royal Society NPI report, and it comes up. So in this report, and just for disclosure, I was part of the group that wrote this report. There are 6 types of NPIs we deal with, and I'm now going to walk you through each of those 6 NPIs. So let's start with masks. And actually, before we start with masks, let me just say to you that when we are evaluating evidence, the evidence for NPIs is not available in randomized controlled trials, except in a handful of studies. So most of the research and most of the evidence that we have for the effectiveness of NPIs actually comes from observational studies. Now, there are a few randomized controlled trials, and I'll tell you about them, but it's very hard to do randomized controlled trials of NPIs because usually they are implemented on a community and a whole nation basis. So you can't really do randomized controlled trials of them. So let's look at what the evidence tells us. So let's start off with masks. Masks and facial coverings, these are barriers to virus particles in the air. So you heard earlier about how it's these little droplets in the viruses which are teeming in these, there are thousands of viruses. So as I'm speaking here, and as you are breathing, you are putting out little drops of saliva, very little drops. And if you happen to have COVID, you have SARS-CoV-2 in the thousands in these little drops. Now, they are microscopic. You can't see them. Some you can see, but most of them you can't see. And it's those little droplets in the air that expose others to this virus. So when you are wearing a mask, you are reducing the amount of saliva and virus that you put out. And if you're wearing a mask, if somebody else is putting out these little droplets with the virus, you won't be breathing them in. So it works both ways. And viruses, they reduce your risk of infection through aerosols and through droplets. So are they effective? Do they really work? Well, there's a lot of engineering data that show that these masks are pretty good in preventing droplet infection, but regular masks actually don't do that well in preventing the smallest of those droplets. And there you need to use better masks. So medical masks do much better than scarves, and N95 masks do the best. So N95 masks, they prevent even the smallest of the droplets from getting in. But remember, with an N95 mask, you have to fit it first and make sure that it fits snugly around your face, because you do not want any of that air to come in through the sides. And there are many, many studies. There are studies that show that mask wearing and mask mandates have an effect in terms of reducing SARS-CoV-2 transmission. There are studies to show that the higher quality masks do better, especially if they have 3 layers in a medical mask. They do better than a single layered medical mask. And a 3-layer medical mask, the N95 masks do better than them. So the better the mask, the better the protection. And that mandatory mask wearing is much more effective than voluntary mask wearing. In that voluntary mask wearing, often those who are at highest risk of spreading the virus are those who are not wearing the mask. So they pose a big risk to everyone else. Now, when we looked at the available evidence, there were 2 randomized controlled trials that looked at the effectiveness of masks. And there are several observational studies. And in this forest plot, I show you that in the observational studies, all but one go in the correct direction, all showing a protective benefit from mask wearing. Both the randomized controlled trials show a benefit in terms of reducing the risk. Let me tell you about one of those randomized controlled trials. So this was a randomized controlled trial done in Bangladesh, published in the journal Science. It was a cluster randomized controlled trial. They took 6,000 villages and they studied almost 350,000 people. And in half the villages, they promoted mask wearing. And in the other half of the villages, they just let people choose on their own will. And what they show is that there was a reduction in the amount of new COVID-19 infections in the communities where they promoted mask wearing. Now that effect was around between 12 and 8%, depending on which marker you wanted to look at. But there is an overall benefit to wearing of masks. So now let's look at social distancing. And if you think about lockdowns, lockdowns are just an extreme form of social distancing. So social distancing, we want to keep people apart. In a lockdown, we want to keep them so far apart that they don't ever see each other. Right? So it's basically the same approach. So in social distancing, what we have found, and the evidence now shows, that as you increase the social distance, you reduce the risk of infectious particles. Now, we were generally using 1.5 meters during the COVID-19 pandemic. 1.5 meters is pretty good because most of the visible droplets, when they come out of the mouth, they fall down onto the ground within 1 meter to 1.5 meters. So most of the visible droplets are gone. So as I'm standing here, most of my droplets are on this microphone and all over here. You're wanting to know how many droplets here? There are lots of droplets here. But as you go further, the droplets are no longer the visible droplets. They're just the invisible ones, the very small ones. And they are so small that they can stay up in the air. So we know that there's limitations to social distancing because of that. But the common recommendation we still use, and for most respiratory illnesses, still 2 meters is pretty good. And it's pretty good when it's used in combination with other NPIs. Now, we use other ways in which we try to get social distancing. We close schools, we close workplaces, places of worship. Those are all social distancing. We're trying to prevent people from getting together. We're trying to prevent gatherings. And I'm going to tell you a little bit more about that a little bit later. But the stay-at-home orders and the physical distancing, all of them have been shown to significantly reduce COVID-19 transmission. Now, you actually don't need a study to tell you that. If you don't mingle with others, you don't get COVID, right? It's obvious. Well, we actually have several studies that looked at the issue, and they show quite clearly significant reductions in SARS-CoV-2 infections. And in subpopulations, it's shown to be particularly evident. For example, in old age homes, where you introduce isolation or you introduce social distancing, where outsiders are not allowed to come in, you reduce the risk of COVID-19 in those old age homes. So the third NPI I want to talk about is test, trace, and isolate. Now, you already heard about the importance of testing, but here, the reason you want to know about test, trace, and isolate is that you want those individuals who are symptomatic to get tested. And when they are tested, you want them to come out of the population. You want them to be basically social distanced so that they're not going around exposing everyone to the virus. Well, it is a pretty good method of determining who is infectious. And if you just do a rapid test, that's a pretty good indicator. The problem is that with SARS-CoV-2, you are spreading the virus long before you become symptomatic. And that's the problem. It's that spread during the asymptomatic period that is in fact more important than when you become symptomatic. And we know that for diseases like measles. You really are at highest risk of spreading it even before you develop the fever and the rash and the Koplik spots. So we really are concerned about that. So tracing is important, and isolating contacts is important, because those are the individuals, you're catching them before they are becoming ill, and you're trying to impact on that group. And we've seen that contact tracing apps can be highly effective. In fact, in this study published in the journal Nature, it shows how the NHS used an app in the Isle of Wight, and how this app was able to avert and reduce transmission of the virus. In fact, for every percentage point of increase in the app uptake, they showed that there was a reduction in the transmission of SARS-CoV-2, ranging from around 1% to about 2.3%. So you see quite a drastic action that comes about by using an app, because it's telling you who's exposed. The fourth is travel restrictions and border controls. I'm not going to spend too much of time on this, because basically they don't have much benefit. They may have a benefit very early on, but very quickly they actually lose any value. So border controls, where you're measuring temperature at the airports, waste of time. I don't know what it's going to take. I don't know how many times I've told my own Minister of Health in South Africa that it's a waste of time. But still, when I go to the airport, when I'm going to go there this afternoon, they're going to measure my temperature. And I think it's just giving employment to somebody to do something silly like that that has no benefit. Anyway, let's leave it at that. Let me tell you now about environmental controls. Now here we've used many different kinds of environmental controls. We use hand washing, and that we know has a benefit. We clean surfaces where we know that people are putting out droplets. We use screens. In my own institute, we built these Perspex screens, and we put them around people in the communal spaces, and we enhance the ventilation. So for example, in an aeroplane, we don't really worry about COVID much anymore because of the way in which the air circulates. The air comes in from the top, but it doesn't leave from the top. It leaves from the floor. The entry point for the air is to flow from up downward. So if somebody's breathing out SARS-CoV-2, it gets sucked down to the floor. So we know that it's less of a risk in an aeroplane. But in a room like this, where the air comes in from the top and the air leaves from the top, you know that it's basically churning out all those droplets you're putting out. As you're breathing, those droplets, they're all churning up in the air. So you want to enhance the number of air changes, you want to enhance the way in which airflow occurs, and they are all shown to reduce SARS-CoV-2 transmission. And then the final of the 6 NPIs is communication. And here, effective communication can really make a difference, because when you tell people what to do, they don't always want to do it, especially when you're telling them that to reduce some of their own freedoms. So you've got to explain it to them, and you've got to provide the evidence to them. And you've got to communicate in a way that ensures that they come to this conclusion themselves, that they need to wear a mask for their own benefit. Not because you told them to do it, but because they would benefit from it. And that kind of communication has been really important. Communication that's built on trust and confidence in those who are communicating, people like you, healthcare workers, the clarity and the consistency of the messaging, and the opportunities that you create for people to implement these social controls. So, essentially, NPIs work. But I can tell you that there are many people who are vehemently opposed to NPIs, and you'll see there are whole campaigns against NPIs. And it was really bad in the US under Donald Trump, because he promoted it. And it's not been unique to the US. We've had it in South Africa. I'd be shocked if you didn't have it here in Zambia. There are all these people who say, I want to do what I want to do. You don't tell me what I should be doing. Okay, you got those wise guys who believe that they should be able to do whatever they want. And that the government is using NPIs to actually exert authoritarian influence on them. So you have to deal with those kinds of individuals. But let's look at what the overall evidence suggests. So this is a paper from the journal Science. And here they quantified the effectiveness of these interventions individually. And they showed how if you ban gatherings, you have a dramatic benefit in terms of reducing the spread of. Now, I don't know if you're familiar with patient 19. Do you know about patient 19? No. Okay, so South Korea had an amazing system in place to identify people when they got COVID-19. And as soon as the first 18 people, when they identified them with COVID-19, they were able to contain the virus. So that's why South Korea didn't really have the spread of the virus for the first 18 patients. But patient 19, firstly, she came from China. And when she came in, when she wasn't feeling well, she first went to the church. And she exposed 1,000 people at the church. She then went to the hospital for a test, and she exposed people there, and then she went to a restaurant that had a buffet. That's when we learned buffets are really bad for you. So patient 19 was shown to have exposed and infected over 1,000 people. So gatherings are deadly, especially buffet gatherings. So don't go to a buffet when there's a new pandemic around. This study by Peter Klimak's group, published in the journal Nature, is a superb analysis of the ranking of the effectiveness of real-world interventions. And they showed, again, the value and the benefits of reducing gatherings. Reducing gatherings has a huge effect because you prevent the epidemic from getting out of control very quickly. And they show how national lockdowns, the use of PPE, individual movement restrictions, every one of those has a benefit in reducing SARS-CoV-2 transmission. I like this paper. So this paper here was published by a group in China, where they showed that using NPIs in China actually not only reduced SARS-CoV-2, which is what they were intended for, they also reduced flu, and they also reduced measles. In fact, in South Africa in 2020, we had no flu season because people were wearing masks. For COVID, they also reduced the number of cases of flu. So they work. NPIs work. Don't let anyone tell you otherwise. They're not talking on the basis of evidence. In fact, several countries, like New Zealand, like Vietnam, basically used NPIs to reduce their risk of transmission. They were able to contain it even. The problem was Omicron. Omicron was just too fast spreading for China, for Vietnam, even for New Zealand. But before Omicron, most of these countries were able to control and contain the spread. So in conclusion, we know that stringent NPI measures reduce SARS-CoV-2 transmission in many countries. Individual NPIs are effective, but they are even better when they are used in combinations. And the more stringent they are, the more beneficial they are. For example, if you use a respirator, you are more efficient than using a surgical mask. And if you use a surgical mask, if you use 2 surgical masks, in other words, creating 6 layers, you do better than 1 surgical mask. And quarantines and so on. So there are many benefits to NPIs. And indeed, NPIs have actually controlled the pandemic in several countries until Omicron. On that note, thank you very much.
Thank you.